Victorians are being warned to protect themselves from mosquito bites after Japanese encephalitis virus was contracted locally for the first time. A Victorian man has from the virus, the Victorian Department of Health announced yesterday, after Australia's acting chief medical officer declared a national alert about the spread of JEV in multiple states on Friday. The Victorian man, who was from the state's north and was aged in his 60s, on February 28. National alert declared amid fears of Japanese encephalitis virus spread. JEV is spread through the bite of an infected mosquito. An autopsy has since revealed JEV was the cause of his, with investigations into how he contracted the virus now underway. The man's is the first JEV in the state, while 7 cases have been found in the state this year. Victoria Deputy Chief Health Officer Associate Professor Deborah Friedman said before now JEV had only ever been acquired overseas. This is the first time that Victoria has ever had locally acquired cases of Japanese encephalitis virus, she said. Associate Professor Friedman called on people to protect themselves against mosquitoes, with JEV spread through the bite of an infected insects. Victoria Deputy Chief Health Officer Associate Professor Deborah Friedman has called for Victorians to protect themselves against mosquitoes. Health Minister Martin Foley echoed the same advice, saying if you're around mosquitoes, please cover up. Associate Professor Friedman said mosquito levels were high across the state, particularly in northern Victoria, increasing the risk of infection. She said people who worked around pigs were advised to get the vaccine for the virus, which also infects pigs and horses. Most humans who contract the virus do not experience any symptoms, or only mild symptoms like headaches or fever. A person with severe disease may suffer inflammation of the brain, sudden onset of vomiting, high fever and chills, severe headaches, sensitivity to light, neck stiffness, and nausea. Associate Professor Friedman said anyone with these symptoms should urgently seek medical help. Australians are being warned to avoid being bitten by mosquitoes. Japanese encephalitis cannot be spread from person to person. The Department of Health is strongly advising people limit their exposure to mosquitoes and avoid mosquito habitats, such as stagnant water.